Dr. Gerson received nothing for actually curing tuberculosis.
And then a smile lit his face.
Basically, Dr. Gerson's cure was and is a special combination of fresh, raw, and cooked organic foods and their juices. In 1924, a clinical trial of 450 tuberculosis patients was launched with Gerson's treatment. 446 out of the 450 walked away cured. Then, Nobel recipient Dr. Albert Schweitzer asked Gerson to cure him of diabetes, along with his wife's lung tuberculosis and their daughter's rare skin disease, and Gerson did. By the time Gerson escaped Nazi persecution in Germany and fled to the U.S. with his family, he was already curing people with cancer.
It is a scientifically verifiable fact that the Gerson therapy cures cancer as well as almost every other chronic degenerative disease. We had a wonderful story of a little boy, 8 years old, who was of a group of 7 other kids. All of them had Ewing sarcoma. He came to Mexico to the Gerson clinic, pale, very thin, no hair, bald, and quite sick with pain. He was put on the Gerson therapy, sent home, and the mother reported that within 3 months the tumor was gone. Not only that, 2 years later he was a strapping young fellow with lots of hair. He was growing, he was active in school. More important yet, he recovered while the other 6 children in the group who had received chemotherapy and only chemotherapy were all dead. Further, any physician is heartily invited to come to the Mexican hospital and visit and see a patient there or visit with the patients, and with their permission, then they would have access to their medical records.
I see the Gerson therapy as the antidote to our chemically damaged bodies and environment.
Prince Charles has demonstrated a profound interest in Gerson's work after seeing a patient with terminal cancer that was sent home to die recover.
I don't think the Gerson's therapy has ever cured a terminally ill patient. People get very confused by this. This is a world of science, a world of data, and Gerson has been looked at many times. If you think of basically what's in Gerson therapy, you really wouldn't expect it to cure cancer. But people, sometimes cancer cures itself. There is a rate of cancer that goes away by itself. Some people didn't really have cancer. It was a misdiagnosis. Sometimes people had chemotherapy many months before and then try, for instance, Gerson therapy. They get better and attribute it to the Gerson therapy or whatever they've done. So no, I don't think there's any evidence that anybody's ever been cured by Gerson therapy.
This man had cancer of the mouth. She had cervical cancer. He had prostate cancer. She had an ascites tumor. This woman had ovarian cancer. With this lady, it was cervical cancer. And this gal had liver disease.
I've never interviewed any Gerson patients. It really is pointless because you can't tell from an interview what took place. I've looked at a few patients treated by other doctors.
A few patients treated by other doctors, but not doctors practicing the Gerson method. Dr. Stephen Barrett had no substantive experience with Dr. Gerson at all. Yet his disparaging cartoons in his books lumped the Gerson therapy with the, quote, other quacks.
The day that my oncologist gave me 3 to 6 months to live, I had 2 big tumors on my liver, and I stayed there for 2 weeks. After the first week, I started feeling better. I started gaining weight. I had hope. And after 2 weeks there, I went home. I attended a cancer support group at a church that we went to. And during that time, I was the only one that was doing alternative therapies. Everyone else was doing conventional. And I watched each and every one of them die.
When I spoke with the oncologist about this Gerson therapy, he looked at me and he said that was probably going to be a mistake because the chemotherapy was going to help me and not any other treatment. Yes, and after I had gone back to the oncologist after I had done the Gerson therapy for a couple months, at that time when they had found that I was cured of cancer from the CT scan that they had done on my abdomen, he couldn't believe it. He thought it was a miracle.
What would it take to convince me that the Gerson therapy works? A simple double-blind study, follow-up, real data. And of course, we'd all be the path to Gerson's door.
Dr. Gerson treated the sick human organism in its totality. He was inducted into the Orthomolecular Hall of Fame just last year, almost 50 years after his death.
Well, the reason we don't like these therapies is, first of all, to give people false hope. And they're rip-offs. You know, there's someone making a big profit off of this kind of activity. And that's just morally wrong. Morally wrong, ethically wrong. It's not right from any aspect at all. Now, we're talking real medicine here. We're not talking alternative medicine. We're talking real medicine. This is how it's going to be. Alternative medicine, there really is no such thing. There is no such thing as alternative medicine. It's just a series of unproven, disproven, and implausible kinds of proposals made for commercial purposes. And we'll figure that out, and then we'll combat them with drugs.
I had an opportunity to listen to a man who's considered, quote, the world's foremost authority on nutrition, unquote. Dr. T. Colin Campbell, Professor Emeritus of Nutritional Biochemistry at Cornell University and author.
I know something about the Gerson Clinic, especially its effect on treatment of disease, and more specifically on with respect to melanoma. They published a study on the effect of their treatment on the ability to keep melanoma in check. And I was very impressed with that because it showed a really substantial effect of the ability of a plant-based diet to keep melanoma from progressing forward. I've known of Stephen Barrett's work for many years. He and some of his colleagues have been taking that approach and supposedly identifying, who are quacks and who are not. I really strongly disagree with his opinions. For one thing, it's very McCarthyist, in the sense that somehow he and others can decide, what's quack and what's not. In earlier days, for example, that group, including Stephen Barrett, took a strong stand against dietary recommendations to consume more vegetables and fruits and grains. They got involved with the American Council on Science and Health, to be specific. And the American Council on Science and Health is basically an organization that's supported largely by industry. They're looking out for industrial interest, and so they don't like what I say, obviously. And they formed some other groups too of a similar ilk. If I or some member of my family were diagnosed with cancer, what I would do is not what is traditionally done. I would not go the route of using drugs. Instead, I would use totally a plant-based diet, maybe enrich it with some other materials that is particularly rich in some of the good qualities of plant-based foods, and make sure you get enough water, exercise, sunshine, and I would just let nature take its course.
Some of the basic pathophysiology of heart disease. It's been my conviction now for about 21 years that coronary artery heart disease, which is really one of our number one cause of death for men and women in Western civilization, really this is a disease that need never, ever exist. What is happening? What seems to happen is rapidly when you make complete metabolic changes due to this plant-based nutrition, you restore the capacity of the endothelial cell, the inner lining of the artery, that metabolic dynamo. That endothelial cell has its capacity restored to manufacture nitric oxide. Nitric oxide is the strongest dilator of blood vessels that the body makes. And it is so powerful that when somebody has angina, instead of getting this vasoconstriction with nitric oxide, the vessel will dilate. With dilatation, there is a much greater increase in flow, and the symptoms of angina will disappear. And obviously, if that continues with the passage of time, unlike bypasses and stents where the benefits erode, the benefits will endure and continue to improve. Improvement from this pinched area here to this area over here where it is now completely resolved. Measured as a 30% improvement. Another surgeon, actually, who had a heart attack, and you can see alongside the bracket here on the left, this long, moth-eaten, injured area, which was too far gone for stenting and too far down the artery for bypass. And with plant-based nutrition, as you can see, within 30 months, he had completely restored the opening of this vessel. What you see is on the left.
Dr. Esselstyn's proof, like Gerson's, of the cure for chronic diseases by utilizing nutrition has been met with almost complete denial by his own peers.
I would say 75% of my patients would react on the Gerson therapy favorably.
Ik weet zeker dat de Gerson-therapie mij...
She described a recovery that stunned her regular doctor, and he could not understand how this amazing transformation had taken place, and could only surmise that it must have been the prednisone he prescribed once.
And it's very difficult to treat them with alternative medicine. It's like a kind of quackery to treat these patients. Well, they fear that many people want to do or want to have treatments on a natural way. And I think there's a lot of pressure from the pharmaceutical industries, and they treat all the patients with chemotherapy and radiation. And when you see that food plays an important role in the treatment of cancer, they fear they will lose control of the popularity of the people.
I think all the medical associations were opposed to the Gerson therapy. Here comes a new approach, a nutritional approach, an effective approach. The medical pharmaceutical industry, if it even wants a cure for cancer, since there's so much profit in this disease, certainly does not want the cure to be a nutritional one.
It is here, at the Loma Linda Clinic, that a precedent was set 16 years ago, when one of these doctors developed cancer himself, colon cancer that metastasized to his liver, and by accident found Dr. Gerson's book.
My name is Dr. Yoshihiko Hoshino. About 16 years ago, I was suffered from colon cancer. I changed to Gerson therapy. Over 500 patients with the cancer visited here, Loma Linda Clinic. At first, we'd like to try to statistical analysis.
This statistical analysis is already well underway on these 500 cancer patients treated with the Gerson therapy, and well over half of them are cured or recovering. The scientific tracking and data is over a period of years and continues. Happy for him because he had found doctors that are free to practice the true medicine. Frustrated because in many other countries this is denied and people pay with their lives. It affects us all profoundly, whether we have cancer or not.
I am looking for the treatment for advanced cancer patient. Then I found Gerson therapy, like Japanese professor Koda's method. And I am very much surprised about the result. Magnificent. I tried Gerson therapy on 50 patients. These are tables.
These tables of the 50 patients Dr. Watayo is tracking verify cures and recoveries over a period of years. On one floor, the making of Gerson juices is being studied and administered to patients and even the staff.
What would happen to the pharmaceutical industry? Oh, they'll be fine. I think that a $500 billion worldwide industry will manage to find other diseases that it can market drugs for. You have only to look on the television to see how hard they try. But there are no drugs with the Gerson therapy. It's all based on nature. It's all based on common sense. It's all based on nutrition, detoxification, and metabolic therapy. It makes so much sense that it doesn't make very many dollars.
No, I don't think there's any evidence that anybody's ever been cured by Gerson therapy.
Well, has the Gerson therapy ever cured a cancer patient?
Well, of course not. They won't even release their records.
I've never interviewed any Gerson patients. It really is pointless because you can't tell from an interview what took place.
And I got this trouble in my abdomen. We went to the doctor and they said I had cancer of the lymph system. They called it lymphosarcoma. In those days, I had a lot of friends who were praying for me that I would survive, not having a whole lot of confidence that I would. And most of them now have gone to their reward, and here I am.
This 88-year-old patient, treated by Dr. Gerson himself, was case number 18 in Dr. Gerson's classic book. A At that moment, I thought back to what Dr. Stephen Barrett had said.
It's all smoke and mirrors.
My suspicions about industrial power against freedom of information and health choices grew ever stronger when I requested interviews with medical doctors and medical students about the Gerson therapy. Some medical doctors were afraid to speak about it for fear of jeopardizing their livelihoods. Medical students were afraid to speak for fear of repercussions. Even the American Cancer Society refused to talk.
I've had calls for 24 years from women that have breast cancer. I think somehow my name got on the internet as a survivor of breast cancer. So women that get in trouble call me, and they're just happy to hear me say hello because they know I'm still around. For the 10 years following being on the Gerson therapy, which took a year and a half, I started going back to the Mayo Clinic and seeing Dr. Scott, who was an oncologist there, just for checkups to be sure I was clear. And he said everything was like an 18-year-old again. My blood profile was perfect, and he couldn't believe how I looked and how much energy I had, and he asked me what I'd done, and I went over the Gerson therapy with him. Dr. Scott said, "That's great," but he said that we can't sell that.
Dr. Gerson called the soil our external metabolism, and without fertile organic soil, our food cannot sustain us.
Dr. Gerson observed and proved that the natural world is our external metabolism.
I cannot understand why my great-grandfather's gift is kept from suffering people on purpose.
What are you going to do? You don't look like the type of man that's going to give up at this point. No. How could I give up, sis, when I see these wonderful results? That's impossible. First, I write the cancer book, and I will have it translated in many languages. The treatment will there, in that book, be described.